Good afternoon. I'd like to welcome you to the Medical Center Hour. I'm Marcia Day Childress from the Center for Biomedical Ethics and Humanities, which produces this weekly series for the School of Medicine. I'd like to welcome you to our program called Echoes of the Heart. A cardiologist discovers his patients through poetry and photography. Patients sometimes complain that they're neither heard nor really known by their doctors, especially perhaps the subspecialists to whom they've been referred for particular procedures. As a result, patients may fear that, unknown to their doctor, they may receive substandard care, or at least not the most personalized attention. Similarly, in fast-paced practice today, some physicians, including said subspecialists, managing patients' complex medical problems, may find it hard to know their patients as persons. Cardiologist Joseph Gascho met these challenges for himself and his patients by devising ways that he could hear and know the persons in his care through the media of photography and poetry. So our Medical Center Hour today examines doctors' uses of the arts to improve the care that their patients receive. Dr. Gascho describes 3 projects that have helped him to bridge the patienthood-personhood gap, enabling him to better understand his patients as individuals and to give them whole-person care, and also enabling patients to better be able to see their doctors as persons with rich, ordinary lives, not unlike their own. We're delighted to welcome Dr. Gascho on my immediate right back to UVA. He's a graduate of this medical school. He also did his internal medicine training here in the first part of his cardiology fellowship. He served on the UVA faculty in cardiology as well until Penn State University College of Medicine in Hershey, Pennsylvania lured him away in the mid-1980s. He's been there ever since and is now both professor of medicine and professor of humanities at Penn State Medical School. He's joined today by physician Julia Connelly on my far right, who until her recent retirement was professor of medicine and a key faculty member in our Center for Biomedical Ethics and Humanities. Indeed, she was my partner in crime in the medical humanities side of our center for many years. Dr. Connelly will offer a brief response to Dr. Gascho that includes discussion of how, for her, photography has become a way to bring care and connection with nature to elderly persons, including some nursing home residents. So we welcome you to a visually rich program with Joe Gascho and Julie Connelly.
Well, it's a real pleasure to be back here at the University of Virginia. I left in 1986, as you said. I'm particularly very happy to have Dick Crampton here with us today. He was my mentor, and he's probably, for better or for worse, the reason I'm in cardiology. I could have some stories. We could spend some time talking about some of the stories I had with him, but we won't go into that today. I have one slide. I didn't know if the right venue to show it out. I thought it not the right venue, and that was him with his white coat on top of a tray sheet with the hour-mile jump. When we went out one day when I was doing research to look for some medical records. You would enjoy that slide. But it's so good to have you here, Dick, and thank you for everything. Well, I'm going to talk about Echoes of a Doctor's Heart, as you've already noted here. And I'm going to talk about how I've used the venues of media, of poetry and photography to look at some of my patients and to look at doctor-patient relationships. Well, as you said, patients ask questions like, does my doctor know that my migraines sometimes keep me off the golf course on Saturdays? Or does my doctor care that the pain in my hip keeps me from dancing Friday nights? Many patients really believe that doctors really don't seriously consider their illnesses and how they impact their daily lives, and they really don't think sometimes that their voices are heard. On the other hand, I'm not sure that patients always think about doctors and how they look at things either. And patients probably don't know that sometimes we think about their problems in a very personal kind of way. For instance, a doctor might say, does this patient know that my father had the same complaint she has and ended up dying after a bypass operation? Or does this patient know that, although I would hate to admit it, in the middle of the night when my heart suddenly races, I too wonder, am I going to die? And obviously, doctors are very hesitant to say things like that. Well, I'm going to talk about several kinds of projects I used to look at patients and their voices, and these are some representative photos from each of the venues that I'm going to be talking about. Okay. John, can you put the lights down just a bit? Thank you. And I also want to look at things from a physician's voice point of view, so I'll be looking at both of those things. Well, most of my presentation will be combining image with word, image generally with poetry or image with prose. But I'd like to read to you a couple of poems that I've written before I get to the combination of word and image. And I think these speak a bit to voice and hearing each other. The first poem is entitled Auscultation of the Heart. I try not to listen too long, because even if it all sounds normal, you will think I have heard the whish of a leaking valve about to let go and loose blood to flood your lungs. But if I don't listen long enough, you will think that by spending less time with you, I can see more patients and make more money and buy a yacht. While listening, should I look at this black double-tubed instrument, or off at the shelf on the wall that holds brochures that tell you how to lose weight and stop smoking? Or should I close my eyes? Should I smile? But not too much. Surely I must not frown. Should I nod my head? Surely I must not shake it. My right hand presses the diaphragm, then bell against your chest. What should I do with my left hand? Can I lay it on your shoulder, or should it hang down limp and loose? At least I need not fear that you know what I think. I think. And then one other poem of a bit more of the serious side. I think this gets at the physician's voice that a patient may not always hear. 2 doors, or 3 at most, you think. So should I tell there may be 5 or 6 or more? I know the door that you should choose, you think. So should I tell that I sometimes must flip a coin? One path leads up and one drops down, you think. So should I say that up may be down and down around? I have the map, I know the way, you think. So should I tell how poor the chart and faint the print? I'll point the way, you'll follow on, you think. So should I tell, I'll go along and hold your hand? Well, the first specific project I want to talk briefly about is a project in which I went to the homes or places of recreation of many of my patients, spent usually 20 to 40 minutes with them, took multiple pictures. On many of these visits, my wife Barb, who is a nurse and chaplain, went with me and really helped very much with this process. The patients were able to show their voice here by the poses and the situations in which they were photographed. And then I matted and framed these photos, and with them, at the bottom of each one, I showed another voice, and that is the typical voice that we as physicians talk about our patients in. The kind of thing you'd hear outside the hospital door, or the room door. 44-year-old male, status post primum ASD repair, hypertension, the kind of thing that lay people do not understand. And this means someone had an atrial septal defect, a hole between the upper chambers of the heart repaired, and they have high blood pressure as well. The point of this was to contrast the person as a patient with the person as a person. And these are on display At Hershey Med Center, permanent display, there's about 50 of them on display here. And patients, even though they don't understand the jargon, patients and families really enjoy looking at these photographs and portraits. So imagine what this person might be like before we go on to look at the photo. Well, this is the guy. We drove down the turnpike. He met us at the exit off the turnpike, said we'd never find his place if he wasn't there, and I think he was right. We drove about 20 minutes off the road from the turnpike, and Barbara said that this would be the place she'd like to go if there was a nuclear attack, because she was sure that no one would ever be able to reach this place. That's how far out it was. But you know, seeing a patient like this in his background, where he is the boss, makes you think about different ways of handling him in terms of recommendations you would make for his treatment. And this gets at a wonderful quote from one of John Stone's poems, in which he talks about visiting a patient who's had aortic valve replacement surgery, and near the end of the poem he says, "Here you are in charge of figs, beans, tomatoes, life." So this is a second patient, 82-year-old male, ischemic cardiomyopathy, ejection fraction 20%, atrial fibrillation, moderate mitral regurgitation, tricuspid regurgitation, Parkinson's disease. Cardiomyopathy is simply a sick heart that doesn't beat as strongly as it should. The ejection fraction should be 55 or 65%, so it's low. That's the squeeze of the heart. Moderate MR and TR means moderate leaks of some of the heart valves in Parkinson's disease. Well, think about this person just a bit. This is a man who landed planes on aircraft carriers in the Pacific during World War II. At the opening of the display of the portraits, my wife observed him looking at his own portrait, and although someone with Parkinson's disease typically have what we call a masked facies, in which they don't express emotion very well at all, he broke out into a grin when he saw his own photograph up there, when he was seen in a different way than this. This is a third patient, 42-year-old male. His heart squeeze is minimally depressed, should be 55 to 65, by a couple different ways of measuring it. On his stress test, the ETT, he reached 14 METs, which is an excellent level, walked for 13 minutes on a treadmill. And because of his age and because of his low heart function, he actually underwent cardiac catheterization, and there were no blockages in his heart arteries. These are always difficult patients to know what to do with in terms of follow-up, in terms of treatment, in terms of beta blockers, medicines that we give these patients. And I think when you know that this is the kind of person he is, it affects what your recommendations are in terms of treating him. He likes to play basketball. The other photo I have of him is of him running. So he's not the person sitting in an easy chair overseeing someone in an office. And a third or fourth patient, 86-year-old female, severe AS, aortic stenosis, narrowing of the heart valve, severe pulmonary hypertension, high pressure to the lungs, very high pressure, class 3 heart failure, congestive heart failure, very limited in what she can do, and a rhythm problem, atrial flutter, and on top of that, a non-cardiac problem, which she didn't need, in addition to these, and that being asthma. And I went to take her picture, and this is her. Doesn't look like she's quite as bad off as her medical description might be. Content to do her sewing in her own home. And then one more, 72-year-old female, history of rheumatic fever. This woman had actually had 4 open heart procedures, 2 to repair a heart valve and then 2 more to actually replace the heart valve. Was very sick between her 3rd and 4th procedure, and had to have then on the 4th procedure, which was a replacement of her mitral valve, the fourth operation for her. But this is her preparing an Indian meal. We went to her home. She actually helped to prepare the meal that we ate at her home. They were very hospitable guests. So these, I think, combine the patient as a person, showing their voice, not a literal voice that they're speaking, but showing themselves in terms of the poses that they put on, the place they want their photograph to be taken, and puts them in a situation in which they are the boss rather than me the boss. It put them in their own territory where they're the king of the jungle there. And I think there's a real contrast between that and how we see the patient too often, which is at the bottom there, the terse medical jargon to describe the patient. And this has been a wonderful experience to take these photos of these patients. And you know, when these patients come back to clinic a year later, they often remind me about the visit. If Barbara went along with me, they'll ask me how Barbara is. They want me to give my greetings to Barbara. And I think it also factors in terms of my care for them as well. Well, this is a second kind of Project 1A, which is similar to the first one, but a bit different. We have a heart and vascular ICU and heart and vascular step-down unit at Hershey. Hershey is into left ventricular assist devices and ECMO, very state-of-the-art technologies of tiding people over before they have a heart transplant, or actually now these left ventricular assist devices are devices that the patients use for the rest of their lives, and they can be for years afterward. It's basically an artificial heart that they carry a little bag around with them. And in the same unit, there are patients who've had heart transplants. And the purpose of this project was to go to homes of patients who had left the hospital. These are not my own patients here. Take pictures of them similar to the ones that I took just in the last project, and then include with this photograph a brief description of what their medical problem was. And then these pictures are on display in our ICU and step-down unit, and they're meant to be reminders and beacons of hope to other patients and families who are in the ICU that there are people who leave and go back to leading normal is too gross a word perhaps, but leading a life, going back to doing the things that they like to do in the past. I'm not going to spend a lot of time reading this, it's beside the point, but this is something that lay people could at least get a grasp of what's going on for this patient. This person is a 53-year-old man who had a heart transplant, and this is the picture that he wanted to be taken of him on his Harley after the transplant. And this was on the cover of Annals as well. And the poignant thing about this is that the heart that he received was from someone who was killed in a motorcycle accident as well. So a very poignant story there. And this is one more person. This is one of my favorite photographs, also in the Annals. The woman here had several surgical operations for congenital heart disease. She was advised strongly not to get pregnant. She and her husband, that she did get pregnant, and came into the hospital, was in the hospital during the time of delivery, and this photograph was taken within days after her delivery, when the baby and the woman and her husband were still in the hospital. And I can't help but think that this gives a certain amount of hope to other people who are in the ICU situation, particularly when it comes to children and carrying on your line that yes, there may be other possibilities after I'm here in this ICU. And several of these photos have been on the cover of Annals. My hope is that this kind of presentation of patients in various venues, have been other venues as well, can help other physicians to think about their own patients and to remind people that, I look at patients in a certain way, but there are a lot of physicians who look at their patients in similar ways. They may not be poetry, they may not be photography, but physicians are thinking about their patients as well. To change course just a bit, this is the physician side of things. I also have taken photographs of many of my colleagues, and these are again also in other places in the hospital, and then the photographs are placed in our clinics so that when patients come to clinic they can see their physician, and their physician is doing something other than listening with a stethoscope or sitting at a computer working on an electronic medical record, which is the picture that many people have of physicians these days. And these are several of those photographs. This is one of my colleagues, Dr. Leuenberger, who is a superb pianist, and I can't help but think that the person waiting to see him is intrigued and comforted by a doctor who listens to heart rhythms, but also to other rhythms. One of my colleagues in vascular surgery who referees young children's soccer games on Saturdays. And this would be, I think, comforting to a family someone who has his children as well, and thinking that their doctor is concerned about children as well. Another face to this person. And I have several photographs of attendings with their children, and families particularly like this. Dr. Silver has told me that various of his patients have commented about this picture of him with one of his children, and I'm now on the list. We've been procrastinating on this, but I need to take a picture now of him with his second child as well. This is how these things continue to go on after the first photograph. And this is yours truly, and I'm not sure what message this gives to the patients here. Perhaps that my bicycling costume did not come out of wherever. This is one of my favorite photographs. This is going to show up in Annals one of these days as well, of one of my colleagues who is a master craftsman. And you know, I can't help but think that when you see a physician who shows such care to woodwork, that you would think that the same person would be showing the same kind of care when he's taking care of you and concerned about your cardiac problem. Well, this is a very unflattering portrait. I never quite realized I have as little hair as I do until I see a picture like this. But one of the primary things that I do in cardiology is to read echocardiograms or sonograms of the heart. And as I read these, I become intrigued with thinking about these images that I see. And this is a quite different scenario. This is not a situation in which I hardly ever know the patient whose echo or sonogram I'm reading. I will have a terse description that this is the age. I can calculate the age based on the date of birth. It's interesting in medicine. We sit in the echo lab and we look at the name first and we try to decide the approximate age of the patient based on the name. And it's an interesting game that we play sometimes, and we can sometimes figure that out. But anyway, we know the age of the person, the gender of the person, and some very terse fact about why the echo is being performed. Dyspnea, shortness of breath, chest pain, whatever else. And it's really led me to think a lot about, musing about how I would feel if I was having this echocardiogram performed. What would I think if I had this diagnosis? I think about the patient. Is the patient inappropriately apprehensive? There are some echocardiograms that we read if we know ahead of time that this is almost certainly going to be very benign and nothing to worry about, but the patient may be very concerned. On the other hand, the patient there may be an ominous 2 or 3 words, and we really pause before we read the echo, and the patient may have no inkling that this is something potentially very serious. And so lots of thoughts go through my mind as I read echocardiograms. And I think this next few slides get at, I'm thinking about the patient's voice, but it's more an implied voice here. I really don't know if this is a true story or not, but I think there's something beneficial about even imagining what someone has in terms of my care for other patients, perhaps. And also, I think I'm sure that other physicians go through this same thing. When you're reading an EKG with a terrible finding on it, or when the pathologist is reading a specimen, that is going to be bad news. I mean, there must be thoughts going through that physician's mind in that situation. So what I'm going to talk about now, I've combined images from the echocardiograms with poems I've written about this image. And it's an imagined scenario. The echocardiogram image is not meant for lay people to understand. On the actual publications I've had of this, I have a description of the echocardiogram that a lay person could understand. It helps in terms of interpreting the poem, and I think it may be some people find this interesting to see something unknown and learn something about the echo, and then combine that with a poem that's written in other kinds of work. So it's a combination of the image here, but not the person's image, but a sonographic image with a poem. And this is a poem, more of a general poem, not about a specific echo, but it's entitled Echocardiogram, or Sonocardiogram. Sonocardiogram, echocardiogram is a sonogram of the heart. We're used to being sonograms of the abdomen for pregnant women and that kind of thing. Addressed to the patient, you gaze upon the image on the monitor. Bits of sound bounced from probe, through skin, to heart, then back again. An instrument to show what made your heart to break. I only wish there was a tool I could use on me, not you, to look inside, not heart, but soul, so I could know for what it yearns, so I could learn to make it whole. And this is a second sonogram poem combination. This is to a 32-year-old woman with palpitations, which is a common scenario for a visit to a cardiologist. You think this flopping and flipping in your heart is your heart about to break, that you will drop like your father did at 45. What we worry about is the aching chest, flip-flops. We dismiss with disdain. We like echoes like yours. All chambers normal in size and function, no significant valvular stenoses or insufficiencies. But tonight, awake in my bed, when the wall clock in the dark living room tolls 2, some demon may jump from my breastbone to my Adam's apple and beat his drums wildly, and I will think this surely is the end. And then a third poem entitled 49-Year-Old Male Pre-Renal Transplant. And the first verse refers to dialysis, hemodialysis patients get. Mondays, Wednesdays, Fridays, tethered to the box that strips the toxins from the blood, hoping that the clerk who worked the double shift won't nod off at 7, slam into a cement truck. I think these must be kind of conflicting images that goes through a pre-transplant patient's mind, that someone's going to have to die before they can live, and what must go on in one's mind. I can only muse and think about that. And this is a poem entitled 55 Male Dyspnea Pancreatic CA. Dyspnea is shortness of breath. And pancreatic CA is one of those kinds of cancers in particular that you don't want to get. When did you first find out? A little ache one day, and then the next, a real pain? Or did the food you'd always had 2 helpings of no longer tempt? I know you know, or do you know, how bad's this crab that's bit and won't let go. The right side of your heart has gotten big, and that's the right side. You can see it's on the left side of your figure. It's labeled RV. I guess from pumping into pipes plugged up with clots of blood. I suck in air through open lips, then stop and blow it out. Tonight, I'll taste each bite, put down my fork before the next, and tell my wife how good she looks. And the image here is that this person has had blood clots travel from his legs to his lungs, and that has raised the pressure. It takes more pressure for the heart to pump blood to lungs that are filled with blood clots, and that's made the right side of the heart to look big, as shown in this photograph, or this image, echo image. The next poem is a little more complicated for lay people to understand. This is about a patient with aortic stenosis. Aortic stenosis is when the main heart valve leading from the heart is narrowed, and the usual symptoms, we usually follow these people until they have symptoms of either shortness of breath, chest pain, or fainting or near fainting. And then that's the time at which we generally operate on these patients when we recommend operations. And this is an older person, and it's one of the dilemmas in cardiology is operating on patients who are in their 80s and sometimes in their 90s as to when you should operate on people like this. And the operation may be a success, but when you're 85 or 90 years old, all that's happened during the time of surgery, you may come back with a fixed heart, but your mind may not be where it was before. And that's kind of a general sense of this poem. Syncope refers to shortness, to fainting or passing out. She found you, head askew on the countertop, torso jammed between the toilet seat and wall, seat still on the seat. She turned the spigot on, filled cupped hands, and threw what hadn't leaked through trembling fingers on your face and called for help. Now you're here, thinking it's 1954, that Ike is president, this place a barn where you slop hogs. Your heart is strong, no fluid in the lining sac, the trouble's in the valve between the pump and pipe that carries life to everywhere. It hardly opens when it should. If next week's 1954, you're in the garage adjusting valves on the old John Deere, they'll send you home. But if you're back, what then? How will you decide between cracked chest, pig valve, and chance of heading back to Ike, or syncope, chest pain, no wind to walk out to the tractor shed? And these are dilemmas that both the patients and the doctors have in situations like this, as to where do you go in a situation like this? And I think it's important for patients and families to realize that there isn't something magical, there isn't some magical answer that we have. And I think if they can realize that we struggle with these things too, that's important. And one more, this is an autobiographical poem. 61-year-old male, systolic click, BAV. BAV stands for bicuspid aortic valve, which is an aortic valve that has 2 cusps instead of 3. And these patients eventually often will need a valve replacement. But another finding that goes with that is that the aorta, which is a large tube that leads from the heart, may become dilated and weak, and it can conceivably crack or dissect, which can be a catastrophic event. Whoever sent you for this test was smart to think the sound she heard was from a malformed valve. 2 cusps instead of 3. She'll tell you when you see her next about what lies ahead. In 15 years or so, an artificial valve. But will she tell you that the pipe beyond the valve could crack at any time? She will not know just what you want to know. Some facts I wish I didn't know, like you. My valve's bicuspid too. And some of my patients, I actually talk with them about the fact that when I go through some of the same decision trees that they go through, I think that it's obviously pertinent to know who you talk with about this, but I think I sometimes show my voice, my non-medical voice to patients as well. Well, just a few more poems from a slightly different venue. These are patients who have said interesting things in clinic, or who I take a photo of and then want to write a poem about them. So just a couple of poems about these patients, and I've hit on various places taking these poems, taking these photographs. This is a man that's not too far from me, actually, who had a aortic valve replacement, and this is more on the humorous side. You bought your Nikon 40 years ago. Not content with the lens, you bought 3 more, and then you sold them all 3 months later. For 1/3 their worth. You said you liked the look instead. I've agonized for months about the 70 to 200 lens, $2,000. I ordered it today. And then this is a dilemma that we see of older people again who you want to know how far to take treatment. 82-year-old woman, coronary artery disease, who had an LAD stent. Heart attack 10 years ago at 72. They stented the widowmaker. That's an artery in the heart, a special artery, who has that nickname, widowmaker, because people die from it. Chest pain again. Stress test, fine, but walked only 4 minutes. Doubt it's the heart, but can't be sure. Trouble finding medicine to hold down the cholesterol, muscle aches, a rash. Try another statin. You say your garden beckons every day. Don't have to worry about decisions. A weed is a weed, and it has to come out. Let me come and help you weed. And then this is a more personal one of a woman that I've taken care of for some time who has unexplained fainting spells that we just can't get to the bottom of, and she comes back time and time again. And this relates to a visit I had with her, and at the end of the procedure, I'd had surgery myself for a malignancy in my nose, and she was concerned about that. It was a very personal experience for me to have a patient express concern to me. So that's the gist of what goes on in this poem. Your cheek and nose look like your boy smeared you with shoe polish while you slept. Blacked out again, you said, 6 other times since I was here. I told the man who walked out from this room before you came that if it was me, I'd take some niacin to raise my good cholesterol. But you? What can I say? The scans and tubes of blood won't tell us why you still pass out. I nod my head and wish you well and say, come back next March. You catch my eye, then look down. What now, I think? There's nothing more I have to give. Doc, how did it go? Last year, your nose was bandaged up. I heard it wasn't good. How did you know? They say they got it all. You smile and say, see you next year. And then this is the last project that I'm working on right now, in which I take photos of patients that I see in clinic. I see patients every 20 minutes, and I can't spend much time with them. But then I have them write down on a piece of paper what they're thinking when they come to see me in clinic, what their ideas are about seeing a cardiologist. And then I put that onto the photograph, and then I also put onto the photograph something for my dictation as well. And just a couple of these. You can't read the writing very well here. This is a man in clinic, and his comments are, have I lost weight? Is my BP going to be stable? Will I find out answers to my questions? Are there any more problems? Will I ever be back to playing drums as I used to? And then my comment is, heart attack 10 years ago, perhaps once a week, has a sensation of a regular fast heart rate with occasional skip beats, makes him feel funny, like he needs to cough, it worries him. He's back to drumming 2 hours at a time and recently drove a race car. So kind of showing both sides of the doctor and the patient's thinking in a situation like this. And I think in terms of time it's 1:07, so I will not talk about the next two, but you can see with the similar situations of patients in clinic. Well, this has been much more a talk about showing images and poems rather than to talk about the theory behind voices, and I'm going to not go into that because I'm way out of my league to try to talk about the theory of it. But just a few comments about this. I think doing these projects has made me understand that our patients speak to us in many different ways, not just in the clinic. There's lots of ways that patients speak to us. And although I've deliberately looked at poetry and photography, I think the doctors recognize this and they understand this as well. And patients' voices are different in different venues. What is heard in clinic, the outpatient clinic or the hospital room, is different from what is heard at their homes. And both of those voices, I think, need to be heard. Or all of those voices, more than two, I think. Hearing patients, for me, through the media of poetry and photography, may provide additional insight, not gained with more traditional venues. There on the left are the traditional venues of talking to the patient in clinic and the dictated note about the patient. And I think that could bear a lot of discussion about how poetry and photography look at this, but to me there's something unique about these that add a kind of another dimension to things in terms of at least me thinking about the patients. And when I spend the time of trying to put something into the form of a poem or spend time working with an image of a patient. And I think and in conclusion, we traditionally think of patients and physicians hearing each other in the clinic and at the bedside. But there are also physician and patient voices outside the clinic, away from the bedside, and those voices are explicit and implicit. And they also need to be heard. And I think that when they are heard, when we try to look at those and try to understand and hear those voices, that doctor-patient communications can improve. I think that patients, that the physicians understand their patients better. And I think that there's some probable reassurance of patients when they understand that physicians maybe have other voices that they haven't paid attention to in the past. So thank you very much.
Thank you. It was a wonderful presentation. It's really interesting always to see how we bring medicine and art, creativity together for the benefit of all of us. It's also great to be back here. I've enjoyed seeing some familiar faces. Since I retired a year and a half ago, I've been working as medical director of hospice at Rapidan, and unfortunately their interdisciplinary meetings are always on Wednesday, so I'm usually in Culpeper this time of day, so I miss being here. Marcia asked me to speak briefly about photography and the role that it's played in my medical career, and unlike Dr. Gascho, I rarely photograph patients, but there's a little growing edge around that, which you'll see. I think we've had a wonderful experience in primary care because we do make a lot of home visits. I live in the community where I see a lot of patients in the grocery store. We know a lot more about what they like to do, and they see me, when I do go to the grocery store with my baseball hat on. So there's some feeling there of the relationship that we get. So photography for me, people that know me well know that I love to be outside, that I love to observe nature and just feel good when I'm there. When I'm outside, I usually have my camera with me. I just like to photograph whatever is offered to me, whether it's a beautiful sunset or a pattern of fallen leaves or a beam of light across a flower or some details of a spider's web. I rarely plan my outings, I just go. And being in the natural world for me is very nurturing, it's restoring, it's exciting, and it's a joyful experience. Medicine has been a joyful, exciting experience to me, but I needed to be restored and nurtured. And so I've spent a lot of time outside taking care of myself so that can then be communicated later to patients. In nature, I feel more resilient, and so that comes back to my practice. And nature photography is kind of like making a home visit. I hadn't really thought about that, but it really is. When you go into nature, one look is worth more than 1,000 words. And that's generally what we say about home visits. So I thought we would just look at a few photographs of nature that I've seen and see if you can get this idea of going into nature and seeing something about yourself that might be restorative, helpful to you. So nature reveals stillness, quiet, peace. Reveals change, reminds us that nothing is really permanent. In nature, we can get very close to life and death. This bluebird flew into my window last winter. It shows us movement, flow in our lives. It shows us possibility. This was after one of those huge snowstorms we had a few years ago, and I just had to get out and just saw this arrangement on the snow. And then there's the surprise and mystery that nature continually brings to us. We've recently started being interested in mushrooms, and I made this spore print and then said, gosh, that is so incredible, I could photograph that. So the experience of nature, again, returns me to my clinical work with a greater presence, patience, curiosity, connection, appreciation, gratitude. The list goes on. Several summers ago, I began studying a type of photography called mixing, which is a contemplative photography where you're photographing pure seeing, pure perception. You don't care what the object is, you just walk along wherever you are, and if something jumps at you, tugs at your heart, or calls you to stop, you stop and you photograph it. This particular photography for me is really wonderful. It's totally free. I don't have to drag my tripod around. I don't carry but one camera, one lens, and then I just walk and see what shows up. So I'll show you a few of these. It's a little lunch in Thailand. I was driving down 211 one day, saw something blue, backed up, went over and said, oh my gosh, and took a lot of photographs. These are common images. You see them every day. Some of them call to us and some of them don't. But all of these call to me. This process helps me with observation. It really focuses my attention in a totally different way. It's really helped me with perspective. Previously, I would have only photographed in nature. Now I can walk into any city in the world and photograph with delight. And it just opens the possibility of being touched, all of them, which are critical skills in the practice of medicine. Now, in the last 8 months, since I've had a little bit more time, I've been volunteering with a group called the Master Naturalist. Virginia has 31 chapters of Master Naturalists. These are all people who love nature. About 8 months ago, I began helping start a program at Dogwood Village in Orange, which is a long-term care community. And the idea was for us to recognize that many of our elderly are disconnected from nature. That affects their well-being, their sense of who they are in the world, their joy, their happiness. And so I invited some of my friends who are naturalists to go into the nursing home with me, and we now have a whole program of bringing nature into the nursing home. And I'll just show you, these are sort of some of the first pictures of people I've taken. Some of them are patients that I've had in the past, but they're all friends now. There's a couple of our naturalist volunteers helping the residents. There's part of their harvest, the social area developed where they like to go and talk to each other. We installed a bluebird trail. These are our master naturalists. A man in blue jeans built all the boxes, and the group went out to install them. A friend who's here today, Pat, is educating the residents about the boxes, teaching them how we maintain them, what to expect. Nobody believed we would ever get a bluebird in there. Here's a resident now looking at the first 3 bluebird eggs. We also go in as small groups and take objects, either photographs or this particular day I took a lot of leaves and nuts and things from nature, and we just start talking about them and sharing stories. They smelled the walnuts and had lots of stories from childhood. They felt the prickly parts of the chestnut. It's one of our volunteers in the yellow. We give presentations usually once a month about nature, all sorts of things. But they seem to really love to learn. And this happened to me after I gave a presentation in the very beginning, and that just told me, okay, I'm on the right track. Let's keep doing this. And we also visit some of the residents one-on-one, people who can't get out of their rooms as well or don't do well in group work. And we just sit and visit, frequently take photographs of nature, and it doesn't take them long to start telling stories about their experiences in childhood and recently. So this is all part of the ORAG Master Naturalist Group. We're a group out of Madison, Orange, Rappahannock, Fauquier, and these are the volunteers that have been working with me on this. That's not exactly part of my doctorate career, but you can see how everything comes together. And it's felt really beautiful to, as a doctor, realize that these people were really out of touch and needed a connection, and to figure that out with my photography and my friends in the naturalist group. So, thank you.
Okay, thank you both very much for, again, a very visually rich set of presentations, and a lot for us to think about and talk about in the remaining minutes. We have 2 mics, so that we can bring the mic to you for your questions, your comments. We may have some other photographers and poets in the audience who may wish to comment on what we've seen and heard, or talk a little about the kinds of projects you pursue, sort of in this vein. Anybody like to start? Well, I'll open with one question, and that was that I noticed, Joe, in your images many times you included the person's hands as well as their face and the activity they're engaged in. I noticed this was the patients, but also the physicians. I'm thinking of the pianist and the woodworker. And then I noticed in Julie's pictures of some of the residents, the hands were there, and they were so expressive. Do you want to say something about what you choose to include in the picture that becomes part of the portrait?
Well, to me, hands are...
Is your mic on, by the way? Slide the little thing over.
Here at top.
On the top?
Or tap
No, on the top, the little box. There you go.
Yeah, well, I think hands are kind of an extension of the face to me. They're such important connections to our cerebrum that they say so much about who we are as people. That to me, that's, I very much like to include the hands as part of the person. Hands alone sometimes are even what we need to do.
Yeah, I felt the same. The couple of hands I photographed, one of the women had a little guard so that if she got out of the range of the nursing home, it would go off. And to me, that was really poignant, you know, or if she fell, something happened. And the other woman that I had photographed, her hands, she was so color coordinated with her fingernails, her 2 pairs of glasses, you know, she was just so sweet that I just had to get her hands. And I think that's a demonstration for me of the contemplative photography. I'm looking more, I'm seeing more of what's offered, and those are examples of that.
Your comments? Yeah. And would you please tell us who you are? She'll bring you the mic.
Hey, Jason Bennett. I work at the library here, and my question is for you, Dr. Gascho, and I was wondering if you have had the opportunity to sort of bring your knowledge and passion to the students in any way, in terms of providing an opportunity for them to learn or explore creativity in medicine.
I haven't deliberately taken that track yet. It's one of the things, we do have selectives for our 4th-year students. The electives would be another word for those, and that's one of the things that it's 2 or 3 years in the future before you can even get something like that set up. Yeah, that would be something I would like to do. I haven't done it deliberately yet in terms of a one-on-one. It's interesting that the tour of the patient portraits are something all prospective med students see, so that a lot of students see these and know about these, but I haven't done anything deliberately yet, but I think it's something important to do.
I know you ask him, but I can also say that a few years ago we were teaching selectives as well, and we decided to incorporate photography. This was before digital photography, so we bought little box cameras for all the students and then made a list of things that we wanted them to photograph, like go to the lawn and photograph something red or photograph a door. They were very broad, and then everyone came back into the classroom with their images and we put them out. And you know, people really had totally different views of things. It was really fun, and then having a discussion around that worked great. The students loved it. Yeah.
We did last evening have a small sort of workshop session for about a dozen medical students with Dr. Gascho, and it was a sort of interactive workshop with the students doing some photographing of each other, kind of following what he'd been doing. And you also talked a little about a project you've just begun where you're photographing medical students at Penn State going through the whole medical school process.
Yeah, I'm following 5 medical students, hopefully from the beginning of the first year until their first real job after the residency. And this is in the second year of doing that, taking a formal portrait every year, having them sign their name every year with an object that they want. So it's a little different. It's not so much teaching, but it's viewing it. I think, to me, photography and seeing are, that's what really medicine is really about, as she's so much talked about in what she said, but learning to see, to me, that's photography, seeing things in a specific way. Poetry is seeing things in a different way, and that's what we need. We as medical students, physicians are all our lives are medical students, to try to learn to do that, which is so hard to do.
Gordon Putnam, chaplain at the Cancer Center. Dr. Gascho, all your pictures were black and white. Are you still shooting film, or did you go to digital? And what's your kind of process in putting all those photographs together?
I really like black and white. I think that there's something about a black and white image that's more striking to me. It probably also is important to know that I'm colorblind, but I just love the black and white images. So they're shot with digital, and in Photoshop there's a very simple way of changing from color to black and white. There are lots of ways that you can do that. So these are all Photoshop manipulated to sound like a base and negative, a bad word, but the images are edited with the use of Photoshop. And what's interesting to me is this is an aside, but we're so fixated on megapixels these days that a lot of these pictures were taken with my first good digital camera, which is a D100 with 5 megapixels, and these are 10 by 14 photos. So it just goes to show that you don't need these 85,000 megapixel cameras that are all over the place these days.
I was interested in the procedural aspect, because you are entering a procedure, and of course we're battered with informed consent. So how do you entice your patients or achieve, the rapport? I mean, it may be a product of your doctor-patient relationship.
Yeah, a lot of it is these are patients that I've known for a long time, and it's amazing. Patients generally really love to have I think most of us like to have a picture taken if someone pays attention to us. So the patients generally like to have it done. A few of them don't. I get informed consent, but I try to be very careful. There's such a power difference between a patient and a physician. And it's so easy, I'm afraid, for the patient to be afraid to say no if they don't want to have their photograph taken. So I bend over 3 times backwards to try, if there's any hint that they really are saying yes just to be nice to me, I will say, I don't think you really want to do this. But 95% of them or so will say yes, but they do get informed consent. Yeah.
I was also going to say something about that. One of the reasons that I haven't photographed patients before very much was just this issue. I'm a little bit shy, and when I know the patients well, I've gone to their homes, but to ask them if I could take a photograph of them. Sometimes it was just because I wanted a photograph of them for myself so I could remember, have that. And I usually just never ask, partly because of the ethics and the question of power. I always wanted to make sure that they could say no, and I was not totally sure that they would say no to me. So I'm glad that you've been thinking about it, and I think it's a really important question that you've asked, and one that really needs to be considered whenever we're engaging with patients outside the usual sort of standard of what physicians and nurses do.
I think too, I send patients photographs afterward, and that also is, patients like to get the photographs. They enjoy seeing them too, and that adds something to that, not as an incentive to try to bait them to do it, but it is at least a good byproduct of that as well.
We've come to the end of our time, but I'd like to thank both of you for your presentations. And it struck me that all the way through watching this, that this was also a wonderful way to honor patients and also to honor the observational powers of medicine. Because you're both exquisite seers of people and of bodies and of nature, and it was really a lovely set of presentations. So thank you very much. Next week, we have a program called Medical Storytelling at its Best with Michael Vitez, Pulitzer Prize-winning journalist from the Philadelphia Inquirer. He's written a book about a former UVA student, now a student at the University of Pennsylvania Medical School, who survived a catastrophic accident, and Michael Vitez wrote his story. Our commenter is our own Department of Surgery faculty member, Forrest Calland, and who helped take care of the student when he was injured. So we will see you here next week. And now please thank Dr. Gascho and Dr. Connelly.